In this video, I would like to talk about the orange light in the traffic light approach. The traffic light approach is the heart of history taking, which I've created for myself, and this helped me take proper history, save time in the history taking, and be a good doctor, good clinician, and pass all my OSCE stations in my first attempt. Traffic light has red light, orange light, and green light. In the next video, I will talk about the red light, and in another video, I will talk about the green light. In this video, I would like to talk about the orange light. The orange light in the traffic light history taking method is the risk factors. These are very, very important because the risk factors are important for you to plan your management. So you need to know what are the risk factors. In the training program, what I've done is I have created this step-by-step approach where we don't miss any risk factor. I start with the individual risk factors first. For example, past history of similar problem is an individual risk factor. Smoking is a risk factor. Alcohol problem is a risk factor. So diabetes is a risk factor. Obesity is an individual risk factor. Then I go to the next one, which is the family risk factors, which is family history of diabetes is a risk factor. Family history of epilepsy is a risk factor. Then I go to the community. So I'm going from the patient family, which is the second layer of risk factor, and the third layer is the community-based risk factors. Something like epidemics in the community. If a patient comes to you with a whooping cough, you think about, can this be an epidemic in the community? If the patient comes to you with an itchy rash on the finger, then can this be a scabies outbreak, for example, in a nursing home or in a nursing facility where there are a lot of residents and there can be an outbreak of scabies in this nursing home or the nursing facility. So you think about risk from the patient, then to the family, and then to the community or the place the person lives in. So if you think like this, you will be systematic, you will save time, and you will be a very good clinician because you're not missing any diagnosis. I hope this video is very helpful. If you would like to know the traffic light system, the 4-phase history taking, make sure you look for a link under this video or in the bio, and I will teach you the frameworks, the tactics, and strategies on how you can save time and be a successful clinician and pass all the OSCE stations in your clinical exam in the first attempt. I wish you all the best, and I will see you in the next video.